very honored to be invited to share with you integrative medicine practice and what resources are available for our patients and care providers. So this is a question I am very frequently asked, not only just by patients, but also by my friend, Wenli, indeed, what do you do? What is integrative medicine? So there's really no consensus on the definition of integrative medicine. The academic consortium defines integrative medicine as the practice of medicine that reaffirms the importance of the care provider and the patient, focus on the whole person, and to bring all available measures to improve overall health. So these are very common questions in my clinic, and patient invariably comes to one major question is, Dr. Liu, what can I eat? What supplement do I take? How much exercise do I do? How much sleep do I, have to have in order to improve my lifestyle, my ability to deal with stress, my chance of fighting cancer, my chance to have the cancer not come back, whether or not it's because I try to avoid chemotherapy or other medication side effect. Do you have a different method that I can use and so I don't experience the side effect? So here's my take on what is integrative medicine. It's really lifestyle medicine. It's to really teach people how to eat, how to exercise, and how to manage your stress. And is to integrate what available medical evidence into people's daily life. That's what I see as integrative medicine, and that's what I consulted on patients on. So what is the goal of integrative medicine? And a bit history of my practice in MD Anderson. So prior to my becoming an integrative medicine doctor, I was an internist. So what I observe patients is that the one who are mentally strong, physically strong, have a good nutrition, they tend to have less side effect from treatment and then tend to recover a whole lot faster after the treatment. So to overall improve fitness. So when we talk about fitness, we always think about how strong you are physically, and we don't necessarily think how strong we are emotionally and how strong we are nutritionally, and that's usually not a major focus. Another focus of our practice is to reduce symptoms. So why do we need to be emotionally fit? Because even beyond cancer, we have daily stress that could be related to our life, our work, relationships. And aside from the side effect of the anxiety and the stress with your productivity and quality of life and sense of well-being, overall, it can actively impact cancer survivorship. So those are the commonly talked about programs, the behavioral programs on treating stress, anxiety, and depression. So we do have programs for teaching patients about meditation, yoga. We also have research programs about hypnosis. There are other mind and body exercise such as Tai Chi and Qigong. Invariably is to help people learn how to manage your emotion, manage your thoughts. One area that we often do not talk about is how nutrition can affect people's ability to manage stress or your sense about stress. But it's very common in life. You send your children to grandma to birthday party, and they come back all very, very excited, and you know what's causing it, right? And somehow that our emotion that to drive us to eat the most immediately satisfying food. That's why we call it comfort food, because that satisfaction is immediate. But a lot of time on those immediate satisfying food, they may not have long-term health benefit. And evidence can help us point that way. This is a review of multiple studies and the conclusion regarding healthy lifestyle compared to, let's see, average diet. And you have a much significant reduction in development of depression with a healthy dietary pattern. So if you look at the spots on the left side, and that's lower risk, and more past the solid line on the right side, that'll be higher risk. On the other hand, the study of Western style diet compared to your average diet, that's much worse in terms of the risk of developing depression. So what you eat definitely has something to do with the risk of develop depression. So high intakes of fruit and vegetables, fish, whole grains may be associated with lower depression risk. So coming to the second fitness is nutritional fitness. Exactly what should I eat? So my recommendation will be plant-based. And plant-based does not mean vegetable-based. So a lot of time people go, Dr. Liu, I eat vegetables and meat. Everything is lean. That may not be a healthy diet. Only part of the healthy diet. So plant-based, it really means most of your calorie and protein actually coming from plant-based food. So it's not that if you eat only vegetables and meat, that means most of your protein intake is from meat. That includes eggs, fish, and dairy, and balanced. And that's very key because not a single food has all the nutrients you need. Not even anything that can be that good. So it needs to be balanced. You need to eat a variety of vegetables, variety of grains, legumes, and even among the meat group, the nutritional balance is different. And whole food. So I'll talk about why we need whole food. This is just a picture of grains. So if you look at, I don't have a pointer, but you look at the majority part of the starchy part of it, it's called the endosperm. The starchy endosperm, even though it occupies about 85% of the weight of the grain, but only has about less than 15% of the nutrients in that group. And majority, 90% of the nutrients is in the germ center and the bran layer. That's why highly refined carbs are not recommended, and the complex carbs are recommended. It's because it's not empty calorie. It does not just provide you with a calorie, it provides with you other nutrients, vitamins, trace elements, minerals. And this, I know this slide is very difficult to see, but if you look at the antioxidant analysis, the phenolic contents of all the grains, the tall bar is the content from the germ center and the bran layer. The very short bar are different grains that are coming from the major starchy endosperm. So you can see if you remove the germ center and remove the bran layer, you're going to end up with only less than 10% of the nutrients. So this is another diagram about nutrition, how much you will lose if you have only eating the starchy part of the refined carbohydrates. I will quickly go over this one. This is about apple. So if you look at the bars, the very first diagram about the antioxidant activity. So if you only use the vitamin C from the apple, that is the level of the antioxidant activity. The middle bar is the apple with the skin, plus the skin. And that's how high it is. But if you remove the skin, you lose about 20% of the antioxidant activity. So that is the reason why the diet needs to be plant-based and needs to be whole food and not highly processed food. So one last point very quickly is that excuse my grammar mistake, is natural safe? And the answer really, it is not necessarily safe. And I do have a patient who will bring to me, well, Dr. Liu, I hear this story. So there is a very big difference between a case report, an anecdotal story, than what we can apply in the general population. And one thing that we do in our life that is very similar to research and not exactly the same is like if you go to a new place, want a good restaurant, what do? You go on the internet and you look for reviews. If there's a 5-star restaurant, but only one review, versus another one with 500 review, which one are you going to go? Very similar, that to apply any evidence in clinic, we need good sounding research evidence to apply it. So I think my time is off. I'll quickly end. Physical activities, and Dr. Susan Gilchrist will talk more, but common sense. The stronger you are, you will feel better. If you think I come to Houston, let me go to Herman Park for a 3-mile walk. If you're strong, you will go. If you're not, you hesitate. Okay, and other very important implication about physical activity, exercise is your body composition, because body composition has a lot to do with how you metabolize food, and the quality of your body. It's a different composition. You know, your lean body, the mass, you know, your total bone plus muscle mass, the percentage in your body, it makes a very significant difference on your metabolism. And I do have a brochure outside to overall introduce what integrative medicine programs are, what do we do, what services we can offer to help improve patients' lifestyle and help with reducing symptoms. And thank you for your attention.